Welcome to Medical Mondays. I'm Matthew Bulow, aviation attorney over at Ramos Law. Each week, we're going to be breaking down FAA medical guidelines so pilots know exactly what to expect and how to protect their medical certificate. We're going to add to our growing catalog on cardiac conditions today by talking about coronary heart disease. This is going to start with a diagnosis as innocuous as angina or chest pain and work all the way up to myocardial infarction or heart attacks and conditions requiring stenting or bypass surgery. Like I said, we'll start with chest pain. If your medical records note angina or chest pain anywhere, that information should be reported to the FAA. You want to collect any hospital or clinic records, including your admission history and physical, discharge summary, detailed progress notes from any visits, and the results and interpretation of any testing performed. Your AME will review the information, determine whether the underlying cause can be identified, and if it can, then your AME will go through the appropriate decision tree for that condition. If it can't, the AME will defer your application to the FAA for further review and possible special issuance. If the underlying cause is coronary heart or artery disease, CHD or CAD, with 50% stenosis or higher, or there's been medical intervention, such as stenting or bypass surgery, then you will have to gather additional information for possible special issuance. For starters, if you hold or are applying for a first or second class medical and have experienced a cardiac event such as a heart attack, myocardial infarction, either ST or non-ST elevation myocardial infarction, you have coronary heart disease in any single artery vessel with 50% stenosis or greater, or you have required treatment such as a CABG or stent, then you will have to undergo either a 3 or 6 month recovery period before you can apply for a medical certificate. The 6-month recovery period applies to CABGs or stents placed in the left main coronary artery. That's the artery that branches into the LAD, which is also known as the widowmaker. For stents placed in any other coronary artery or heart attacks or NSTEMIs, the required recovery period is only 3 months. Following or during your recovery period, you'll want to collect all the documents on the protocol for CHD first or second class worksheet. That includes complete hospital records, a cardiology narrative, which must meet FAA specs, lab results, including an A1C, lipid profile, and INR readings. If you're on warfarin, of course, a post-event stress test with imaging, a CAMI limited certificate petition, which looks a little bit like this and lets the FAA know whether you're willing to accept a lower class or a more restricted certificate if review of your application indicates the risk cannot be mitigated sufficiently for the class applied for, but may be sufficient for a lower class or a more limited certificate. And for first class and full second class applicants, post-event heart catheterization with imaging is also required. Following submission and review of all that information, the FAA will determine whether or not to grant a special issuance authorization. If granted, the SI letter will outline the terms of issuance for your medical certificate and the terms you'll have to comply with to remain eligible for certification. For third class applicants, there is no mandatory recovery period. So once your treating cardiologist or other treating physician clears you, then you may apply for FAA medical certification. Once cleared by your own doctor, you'll want to start a nearly identical record collection process to the first and second class applicants. You'll need hospital records, a cardiology narrative, lab results, an exercise stress test with electrical tracings performed after the event and within 90 days of your AME exam. Similar to first and second class peers, third class applicants will have to wait for FAA review to decide whether an SI is going to be granted. If an SI is granted and the condition does not deteriorate, then the airman's AME may reissue each subsequent medical and SI under the AASI protocol, which stands for AME Assisted Special Issuance. Prior to each AME physical exam, you'll see your cardiologist to have them complete the CHD recert status summary. If all items fall into the yes column on that worksheet, then your AME should be able to issue you a medical certificate at each subsequent interval. Be sure that you are going in early, usually 2 months prior to expiration, when your SI authorization letter itself is nearing its expiration to ensure that you don't experience a lapse in certification at that time. If you have any questions about the path to medical certification after a heart attack or have an idea for what conditions should be featured on our next Medical Monday, drop a comment below. As always, like, follow, and subscribe for more aviation law content, and we will see you next week for another edition of Medical Monday.